These have been incredibly difficult days for the entire country. Across the country, what we're seeing is over 44,000 cases and 544 deaths. First case diagnosed was here in Washington, just right outside of my district. We had 2,200 cases and 110 deaths. Our state and local officials have acted very proactively, and frankly, we're fortunate that we have a public health system in Washington state. We are still very far behind where we need to be. And part of that is a far too uncoordinated federal response. We also can't keep our health workers safe. Grocery store workers, bus drivers, others who have to continue to keep our systems going. But they're also dealing with, how do I take care of my mother? How do I take care of my kids? How do I pay my mortgage?
And your kids are not in school, and your mother may be in a nursing home, which scares the hell out of you also.
Exactly. If we had Medicare for All in place, we would have been far better prepared to handle the crisis.
What we're starting to understand is that there's probably a high probability that this disease can go asymptomatic in certain people. And in those asymptomatic people, they may be, in fact, spreading it even though they don't have symptoms. If I'm sick, right, I stay away from other people. It's a kind and conscientious thing to do. But if you don't even know you're sick, then you may not be doing those things. And so you may be out and about in the world. And that's why it's so important that we socially distance, because we may not know if, in fact, we are carrying the disease and maybe passing it on to other people. We've got to pretend like we have the disease and we don't want to pass it on to people we love who could have a really bad outcome. If we spread the disease fast enough, then it may overwhelm our healthcare system. We don't want to get there. And so it's really important for us to make sure that we are not a part of spreading the disease.
We learned about COVID-19 from the WHO at the end of last year. And that's why it's called COVID-19. Since learning about it, different countries have reacted differently. And we see that policies that they put in place have affected their outcomes. Right now, the U.S. has more cases of COVID-19 than any other country in the world. By this weekend, we'll have more cases than any other country cumulatively, including China. The reason is we're not in that first group of countries that took this very seriously. We initially said, well, it's not a big deal.
Well, it's not we. Let me interrupt you, Doctor. I mean, I don't intend to become very political tonight, but it's not the we. We had a president of the United States who downplayed this, who is still, in my view, downplaying it. Is that a fair statement?
It's fair. And just as you said, I don't want to take any blame for this myself either. COVID-19 came in and essentially exposed our very, very fragmented and fractured healthcare system and showed everyone how truly broken it is.
Health is about the political choices we make. And when we see that countries have been able to control epidemic disease, it's because they're making political choices. You can't ask people to stay at home if they have to work, if they have no food, if they have children to take care of and need to feed their families. So if we're asking people to quarantine or isolate, we have to provide the adequate social support. If we had the political will, we could do it. And that's what was done in Korea. That's what was done in China. Are they more advanced societies or richer societies than we are? No. They're just making different political choices.
And everybody stay healthy and listen to what the doctors had to say.